participants for giving me this opportunity. This paper is prepared by me, myself, and my colleague, Mr. Uttam Kumar. He's the director, Sense International India, but he's not able to present today due to some reasons. So I'll be presenting on using technology to reaching out to people with deaf blindness during COVID-19 pandemic situation in India, Bangladesh, and Nepal. So when we talk about the population of three countries, uh, there are around 500,000 people with deaf blindness living in India, and since International India is reaching to 78,000 children and adults with deaf blindness in the country. If we talk about Bangladesh, then there are 110,000 people with deaf blindness in the country, and we are reaching out to only 1,600 children and adults in the country. And if we talk about Nepal, then there are around 436 people with deaf blindness, and we are reaching to around 100 people with deaf blindness in the country. So if you can see the figures in Nepal, we have the exact figure, that is 9,436. You may have the question, why? Why? Because there was a survey in 2011 in Nepal, and during that survey, the census survey, the data of people with deaf blindness was covered. So that's why we have the exact number there. Challenges we faced during the COVID situation. So first, I would like to talk about the challenges, and then I will take you to how we overcame the challenges and what kind of technologies uh, we used to meet those challenges. So initially, there was a lot of uncertainty, and nobody knew about when the situation would go normal, or it would come back to the normal life. Even now, if you think about, it's not going on the right track. We are still working on various ways to meet the challenges. Even now, life is not that normal, which it used to be 9 months back. And if you see at the USP of our educators or our working with family members or people with deaf blindness, then our main USP is hands-on working with people with deaf blindness. Educators go to the field and they work on with hands-on mode. But during the lockdown or during the pandemic situation, this was not there. So people were not able to go to the fields or go to the center, school or home-based education and work directly with students. That was the biggest challenge we faced during the pandemic situation. And another is ensuring achievements of aims and objectives of the project was very difficult, because at one point of time, there were a lot of donors who were asking us, how are you planning the activities, or how are you addressing the issues, or how are you meeting the challenges? But the main challenges that we were facing on ground, where we were not able to directly go to the field and work with students or adults with deaf blindness, people with deaf blindness. So that was the challenge. But having said that, the donors had also a very valid question on how we were trying to address them, because they were providing funds. Another point was building confidence amongst stakeholders, including donors, and justifying our time during the pandemic situation. Even now, there are some places or regions or areas where we are not able to go and address the need-based education of students with deaf blindness. So there were a lot of questions from the donors that how are you going to justify the time or the money they are providing to us. So another challenge that we faced was we thought about technology, but video calling was one of the best solution we had. But again, video calling versus receiving instruction over videos was very difficult, because earlier educators used to go and work with students with deaf blindness, but the role uh, immediately changed, and parents became the educators or the instructors. So when we were trying to provide the instructions through video conferencing to parents, then the parents were not able to address those needs very comfortably to students with deaf blindness, so or learners with deaf blindness. So that was a very biggest challenge. And the last part which we faced, which we think that it is a biggest challenge, is related to policy issues. There were no guidelines on how to delivered the online sessions or the therapy part or the education part. Everyone was saying that we have to do something, but how, what, where, when, or how to deliver the therapy, that was not known. It was a very challenging part to, I think, not only to us, but the entire world. So what we thought of, oh sorry, what we thought of is that we first thought of addressing those needs, keeping students with deaf blindness or learners with deaf blindness at the center, and then providing support to them as per the need or condition or situation of that particular area or that particular household or that particular individual. So initially, when the pandemic situation started, then we tried to support with the rations, because first we felt that food is the most important part. So people were dying of hunger rather than other approaches. So we felt that food was the most important. We provided ration kits, and our educators traveled to different places. So if you see on the top where there is a boat, and that's a picture of our educator in the field in one of the rural areas of India, where they are delivering rations to students with deaf blindness. And then we also thought of providing online training uh, uh, to parents. Where on the left hand side you can see a parent, mother, providing training to her child, to the young boy. So uh, everything was going online. So that was one approach we took. Initially, we wanted to understand the situation of parents and people with deaf blindness. So we thought of doing a small survey on their understanding of COVID and the psychosocial impact that COVID has brought in their lives. So this survey is done with 80 parents, and 48% were male and 52% were female. So we wanted to understand the knowledge of COVID. So we asked them about their child only. So around 44.4% from these 80 parents shared that their child didn't have any knowledge on COVID-19, because it was a very new case, and people with deaf blindness, they didn't have any technology or any kind of information to receive those cases of COVID. So they were not aware. But around 81% of the parents and caregivers shared that there were very less behavioral issues or anxiety seen among students with deaf blindness. And 64.2% of the parents expressed that their child required uh, training on COVID-19. Uh, we did another survey with people with deaf blindness, where there were around 60 adults with deaf blindness, 31 were male, and and 29 were female. So, and 83% of participants were below 25 years of age. So there you can see some questions on psychosocial issues like physical abuse, depression, health situation, emotional abuse, and awareness on COVID. So if you see the graph, there is around 14.34% of the people said that they are facing some kind of emotional abuse. So when we looked into the more detail, then we found that the pandemic situation had brought a lot of isolation among people with deaf blindness. There were no communication because they had to stay at one particular place, and those learners who, or those adults with deaf blindness who were in the income generation activities, they were not able to go out for their jobs and so on and so forth. So if you see the situation of persons with deaf blindness who has been affected with COVID, as per the government status, there is no official data, but from the Sense International India's uh, uh, Sense International India's database, we found that there were 3 cases who got COVID-19 detected, but all of them have recovered as of now. Regarding the technology that government initiated were that the government launched an app called Arogya Setu app, which you can see on the uh, right side of the slide. So it's an app which can be downloaded, and that app will help us track. If we register in that app, that will help us to people are infected in and around our locality or environment. So the government made it mandatory for everyone to download and then register in the Arogya Setu app. But again, there were challenges because not many people have smartphones because it can be downloaded on smartphones. However, this app's other challenge is that it only shows infected people staying or living around, but it will not show the recovered people. However, you have to keep on uh, uh, putting the data of your health and all. The government also initiated the WhatsApp and other social media uh, uh, social media applications like Facebook Messengers, Facebook, and New Desk Telegrams and all. So the government tried to use all these technologies to make their presence on social media and create awareness among people. They also try to create awareness through the general mobile phone as well. So, what Sense International India did is that uh, I'll first take you to the impact in the lives of people with deaf blindness. So a lot of people in India, Bangladesh, and Nepal are coming from a very poor or very poor background, and it's and they also have other issues, financial issues, emotional burdens, and so on and so forth. And awareness among people with deaf blindness and medical paramedical professionals are also very less, and they also face lack of uh, therapeutic and other facilities during the COVID situation. Uh, and when it came to technology, there were other challenges as well. For example, not many had smartphones, and at in some countries like Bangladesh, Nepal, and in India also, the internet data or data package is very expensive. So, for example, in Bangladesh, 300 taka will provide you 1 month's data package, but which is equivalent to pound 2.66, and uh, it will provide 10 kgs of rice. in the lives of people with deafblindness. So it's poverty is quite high there, and network connectivity is a challenge because of the hilly terrain in Nepal and other areas, and the poor physical infrastructure at home, and children are not able to sit peacefully and attend sessions. So here we have a case story of a young boy from Bangladesh, where he had faced a lot of challenges during the pandemic, and he was emotionally hurt. He was feeling isolated, and he always wanted to go back to the center, because at center he feels that there is someone to communicate with him, someone to uh, understand him. However, his parents also faced a lot of issues because of the economical status, and parents were not able to provide adequate food to their child. So, what were the technologies used during COVID? So initially, we followed up the government announcements and actions, which were again online, okay, through social media or television or smartphones. Then we had to monitor, we had to keep on the work going on. So we did the monitoring of all the uh, uh, students or service users and their families through online monitoring system. We use mobile phones, tabs, applications, social medias, everything. And we also use the uh, the regular calls as well. The best thing of the online the pandemic situation is that there are, we have two online courses, for one for educators and one for parents, and it's a course for 3 months. So during this on pandemic situation, we encouraged and motivated parents and educators to join this online course on deafblindness, and around 150 educators and parents have been enrolled and have, you know, passed out from this course. It is a 3 months course, and it has helped a lot to parents and all. All the on-site training and monitoring has been going on through online applications like Zoom, Google App, Google Meet, uh, and so on and so forth. The partner level activities is also going through online mode, uh, using various applications, mainly Zoom app, the Google Meet app. Uh, these are the basic apps, but yeah, we have shifted our office to online modes. So most of the staffs are working from home as of now, because the cases are growing. Still, it is growing very high, and a lot of people are working from home only. Educators are also providing regular support to students with deafblindness and the parents, from online mode only. Uh, and at some places, like in rural India, rural Nepal, and Bangladesh, people don't have smartphones. So we came up with this idea of lending a phone from the neighbors. So we requested the neighbors to provide smartphones, uh, and uh, the regular sessions are going on. Refreshable braille displays are also being used by adults with deaf blindness, people with deaf blindness. We are also using Morse code applications. This is a very recently launched applications. It can be downloaded from Google's Play Store, and around 70 students with deaf blindness or learners with deaf blindness are using Good Vibes app application, where it's an application which can send messages through Morse code and receive messages through vibration. So adults with deaf blindness or learners with deaf blindness are using these applications as of now. They are learning as well as using, and a lot of documentations have gone through Google drive mode. So we are storing the documents and receiving documents through Google Drive. Awareness was done through media. A lot of awareness in Google, COVID-19 and other things related to deaf blindness happened through media, which is social media, and through local medias, local uh, broadcasting medias, radios, uh, so on and so forth. The most important part is accounting system. So earlier we had to rely on the manual situation. We have shifted. We are kind of shifting to online accounting system. So papers are being signed through virtual signatures. Uh, we are shifting to online money transfer as well. Uh, so bank all the banking system are being online only. Salary system is going through online, and a lot of webinars are being conducted. So as of now we have completed around 12 webinars where uh, approximately 3,000 people attended this webinar. So it's a national level webinar in India, which we are doing, and it's a very huge success. And we are also earning a lot of income from these webinars as well, along with creating awareness. So awareness like uh, on COVID situation, and awareness on COVID in different languages or sign languages were created and then published on various medias as well. So you can see the photograph where we are, the educators is on the mobile smartphone through using the data, and is communicating with parent and student with deaf blindness. Apart from that, we also prepared a lot of reporting format, because it was the requirement from the donor as well. So we prepared a lot of formats, reporting formats. You can see the weekly reporting format. Okay, this reporting format, again, the educators were working on a daily basis through online mode, and these report had to be documented. So they documented the report, and they had to send on a weekly basis to Sense International office. uh, Again, the reporting system was linked with the IP goals, and uh, those IP goals again had to be monitored through online. So we also created a mechanism of uh, uh, recording all the documents through online mode. So this is the documents which was uh, initial challenge which the parents shared was that when my child was in the center at the center, they were following some set of routine, but at home they were not doing anything. So what we thought of was creating a routine for students with deaf blindness at the home environment. So we came up with this sort of idea, and again, this was uh, addressed through online mode by educators, because educators had to monitor the activities as well. So as you can see, morning, afternoon, and evening, and there is the time mentioned as well. So it's not that they had to follow certain set of activities, but it's the same ongoing activities only. In the morning, everyone gets up and does the brushing activity, and there is a free time, there is a breakfast time. So those activities were put in this format, and the educators had to follow up on this. And then we also linked it with the IP. So as you can see, this format has been directly linked with the IP. So we try to sort of create those areas here, activities for daily living, motor skills, orientation, and mobility. And what kind of activity educators can through teach parents through online education system. So we sort of try to create this in to support the educators and parents. So here is a very short video. If it plays, this is the activities which happened during the lockdown period. So all these activities were supported by educators through online mode only, and it is being carried out as of now also in line with the IPs. Apart from that, we did a lot of support, as I mentioned, in terms of providing ration kits to students and families with deaf blindness. So these are the some of the photographs and some items which we provided to them. So a total of 1,100 people with deaf blindness and families were supported, and around 28,600 kgs of staples were distributed for 2 months, and it is still ongoing. If we compare it in USD, then we provided around 30,800 worth ration kits during the COVID-19 situation. And in spite of the COVID-19 pandemic situation, 80 people with deaf blindness were involved in various IGA activities, and they are still running their shops because they had to carry on with their daily activities. So again, with the support of educators through online mode and their parents, they are able to sustain their business. However, it also depends upon the directives or advisory from the government on day-to-day basis when to start and when not to start. However, the educators are constantly in touch with all the um, adults with deaf blindness who are running the income generation activities. Yeah, and thank you so much.